The Minister of Health, Osagie Ehanire, has ordered that no patient brought in on an emergency should be denied attention. This is coming on the heels of multiple complaints from the public about the rejection of patients who are in dire need of hospital care. The Federal Ministry of Health finally reacted in a meeting with medical directors of hospitals within the Federal Capital Territory to address this growing challenge. TVC News' Kemi Balogun reports on this.
This is the 5th hospital we're coming to today.
Several videos like this have popped up online in recent times due to the growing rejection of patients by mainly government hospitals due to the coronavirus pandemic.
In each case, when we get there, they will tell us that there is no bed space.
Various hospitals have over the last few months constantly rejected patients, especially those who possess similar symptoms to that of the coronavirus, like asthma, and this is usually over fear of contracting the virus. This has resulted in a number of complaints from the public on not getting adequate routine healthcare services across the country. And now, after months of public outcry, the government has listened and is ready to act on this and solve the problem.
Many people have lost their lives, haven't been denied attention in hospital, or haven't been told that there is no bed. Often after they have made marathon journeys from one hospital to the other in search of help.
This meeting is so important in terms of thinking, how do we completely change our patient flow through our hospitals in a sustainable way? By the end of this weekend, we will support the FCT team in operationalizing 7 initial sites.
A lack of personal protective equipment and shortages in bed spaces are only some of the challenges highlighted here by medical directors of hospitals within the Federal Capital Territory.
Of no bed space will continue to arise. So we have had to keep patients together and keep social distance between them by separating the beds far off. Turnaround time for results to come back was quite long, 4 to 7 days, average of 5 days.
And in response, the Minister of Health assures that the situation will change with the addition of more testing centers to reduce the turnaround time for results.
We have provided personal protective equipment, training, and an infection prevention and control protocol for doctors and nurses to discharge their duties safely without risk to themselves. I have directed that a site laboratory for a gene expert COVID-19 diagnostic machine, which delivers results within 1 hour, although it has a small throughput, should be deployed and activated at National Hospital Abuja and the University of Abuja Teaching Hospital to cut down waiting time.
Bed spaces for non-COVID patients. The issue has been discussed at length here, and to a very large extent, it's more of a perception issue in terms of rejections.
There is so far no specific data on how many Nigerians have been affected by the lack of access to healthcare services across the country, but rough estimates put them in thousands, with a few number dying before adequate healthcare is received. This meeting is the first step in ensuring that patients who need care during this time get it, and this will help to reduce deaths coming from other diseases other than the coronavirus itself. Kemi Balogun, TVC News, Abuja.